How to manage IBS through diet. Irritable bowel syndrome, or IBS, often presents its victims with pain, bloating, and stomach aches. Learn how to minimize the symptoms by making smart food decisions. You will need low gas, low irritation foods, soluble fiber, laxatives, antidiarrheals, a doctor, and a dietitian. Step 1. Avoid well-known gastrointestinal triggers, such as foods high in fat, insoluble fiber, refined foods, caffeine, coffee, carbonated beverages, and alcohol. Even decaffeinated coffee can trigger an IBS episode. Step 2. Eat foods rich in fiber, such as dark and leafy greens, legumes, whole wheat flour, and nuts. Step 3. Utilize a fiber supplement, such as wheat bran or an over-the-counter supplement, to increase bowel movements and avoid constipation. Step 4. Consider using a laxative for constipation or an antidiarrheal for severe bouts of IBS. Be aware, though, that long-term use of such medications can actually worsen symptoms. Step 5. Ask your doctor to recommend a registered dietitian. A dietitian can help you avoid IBS triggers and tailor a healthy menu to your lifestyle. Did you know? Ancient Egyptians used castor oil as a medicine and as a laxative.
How to hold it in when you have to pee and there's no bathroom. Prevent yourself from peeing in your pants with these tricks. You will need a sexual fantasy and butt squeezes. Don't hold in your urine if you have a bladder infection. It will make the condition worse by allowing the bacteria to flourish. Step 1. Fantasize about sex. Experts say thinking about sex preoccupies your brain, reducing your discomfort. Step 2. Scratch or rub the back of your calf. Australian researchers found that doing this vigorously may interrupt the message from your bladder to your brain that you need to go. Step 3. Reduce the urge by squeezing your butt as tightly as you can, holding it for several seconds, and then repeating 5 times. Doing butt squeezes will firm your bottom, too. Step 4. Cross your legs and bend forward slightly, especially if you feel a cough, sneeze, or laugh coming on. Researchers found that this prevented leakage in 73% of women. Step 5. Reduce the chances of finding yourself in this position again by using the bathroom before you know one will be unavailable for a long stretch. It was good advice when you were 4 years old, and it's good advice now. Did you know Hugh Jackman accidentally peed on stage during a performance?
How to prevent an upset stomach. Put down that donut, tweak a few unhealthy habits, and you can beat those chronic stomach problems before they flare up. You will need a food diary, exercise, fermented foods, herbal tea, rice water or apple cider, and vegetables. Optional, yoga. Step 1. Start a food diary and make a note every time a food irritates your stomach. Step 2. Exercise 30 to 60 minutes a day to maintain a healthy weight and reduce stress. Even a short walk after dinner will help. Step 3. Eat smaller meals and avoid alcohol, cigarettes, and regular use of pain relievers such as aspirin, ibuprofen, and naproxen, which can inflame the stomach lining. Step 4. Whenever you indulge in a meal of fatty or fried foods, try to also eat fermented foods like pickles, sauerkraut, kimchi, tempeh, and yogurt. The bacteria in these products help break down and absorb fatty foods that are difficult to digest. Some yoga poses aid digestion by increasing blood flow to the digestive system. Step 5. Drink soothing herbal teas such as ginger or chamomile teas, rice water, or apple cider. Step 6. Eat raw or steamed vegetables. Cooked veggies are depleted of some of the enzymes that benefit digestion. Step 7. If you still experience frequent upset stomach, see a doctor about possible food allergies, ulcers, or other conditions that irritate the gastrointestinal tract and need further treatment. Did you know abdominal pain can stem from a pinched nerve in the spine? How to prevent constipation. Constipation affects almost everyone at some time. Follow these tips to help prevent it. You will need water, exercise, high-fiber foods, ginger tea, folic acid supplements, and sleep. Optional, a medical checkup. If constipation is accompanied by recurrent vomiting and abdominal pain, seek medical attention. Step 1. Drink at least 8 to 10 glasses of water per day. Constipation sufferers are often dehydrated. Step 2. Stay active. About 30 minutes of physical activity each day will not only keep you in shape, but also reduce the risk of constipation. Check with your doctor before starting a new exercise regimen. Step 3. Eat foods rich in fibers such as fresh fruit and vegetables with skins, beans, oatmeal, and high-fiber breakfast cereal. Step 4. Try ginger tea, which helps improve digestion and calms down the stomach after a heavy meal. Step 5. Constipation can be a side effect of a folic acid deficiency. Try a daily 60 microgram folic acid supplement. Step 6. Lack of sleep can lead to anxiety, which in turn can cause problems in the digestive system. Aim for at least 7 hours of quality sleep per night. Step 7. If your bowel patterns remain abnormal, visit your doctor. Prescription medication or an underlying condition could be the culprit. Did you know? Resisting the urge to have a bowel movement can increase the chance of constipation.
How to prevent gas. While intestinal gas is a normal occurrence within the digestive process, it can also cause bloating, burping, and flatulence. Follow these tips to remedy the problem. You will need a review of your diet and antacids and other products. See a doctor if persistent gas is accompanied by diarrhea, constipation, vomiting, or weight loss. Step 1. Gas is often created by excessive air intake. Avoid eating too quickly, drinking through a straw, drinking carbonated beverages, chewing gum, and sucking on hard candy. And quit smoking. Poorly fitted dentures can also cause you to swallow excess air when eating and drinking. Step 2. Diet can be another culprit. Try cutting back on items such as milk and other dairy products, onions, apples, beans, broccoli, and artificial sweeteners. To figure out which type of food most affects you, eliminate one at a time and see how your body reacts. Step 3. Try over-the-counter remedies such as antacids, simethicone, and lactase supplements. Step 4. Take a 10 to 15 minute walk right after eating to aid the digestive process. Avoid lying down right after a meal. Step 5. Antibiotics can disrupt the flow of bacteria within the body, causing gas. Talk to your doctor if you suspect that antibiotic usage may be a culprit. Step 6. Intestinal gas pain usually runs its course within several minutes. If it persists for an hour or more, consult a doctor. Did you know? According to the Mayo Clinic, it's considered normal to release intestinal gas 14 to 23 times a day.
How to use uva ursi. This wild-growing herb has been used for centuries to improve urinary tract issues and resolve bladder infections. Flush away bad bacteria quickly and naturally with various forms of uva ursi. You will need uva ursi capsules, a pot, dried uva ursi leaves, a strainer, a mug, honey, and uva ursi tincture. U.S. Food and Drug Administration does not regulate the strength or effectiveness of herbal supplements. Brands may vary in dosage and strength. Always check with a physician before starting an herbal regimen. Step 1. Take uva ursi capsules by mouth as directed. Capsules are generally 400 to 800 milligrams. Take 2 capsules up to 4 times daily and follow package directions. Uva ursi is also called bearberry, as bears like to eat the plant's berries. Step 2. Drink uva ursi tea. Simmer 1 tablespoon of dried leaves in 2 cups of water for 30 to 40 minutes. Strain and drink half a cup of the tea twice daily. Sweeten the tea with honey if desired. Because of potentially dangerous side effects, uva ursi should not be given to children. Step 3. Try an uva ursi tincture. Take 6 to 12 drops of the liquid tincture 1 to 3 times daily, or dilute 1 teaspoon of the tincture in 1 cup of water. Uva ursi tincture, capsules, and tea can be found in natural food stores. Until the development of sulfa antibiotics, uva ursi was a common treatment for bladder and related infections. Step 4. Avoid using uva ursi for more than 5 consecutive days. Hydroquinone, a key chemical in uva ursi, can be toxic to the liver. Long-term use can cause serious liver damage. Step 5. Know that side effects may include nausea and vomiting, irritability, and insomnia. Because uva ursi is alkaline, limit acidic foods like citrus, pineapple, and tomato when taking uva ursi. Did you know Sir Alexander Fleming accidentally discovered penicillin in 1928 after mold invaded his petri dish and killed the surrounding bacteria?
How to soothe heartburn. Waking up in the middle of the night with heartburn is no fun. Fortunately, there are some simple remedies for fast heartburn relief. You will need a glass of water, baking soda, vinegar, chamomile tea, and peppermint leaves. Optional, some honey. Step 1. The fastest way to get rid of heartburn is to stand up. Heartburn is caused by food and stomach acid moving up the esophagus.
Standing helps gravity work for you instead of against you. Step 2. Try a spoonful of vinegar. Heartburn is sometimes caused by too little stomach acid. Vinegar gives the stomach what it needs for efficient digestion. Step 3. Drink a glass of water followed by half a glass of water mixed with 1 teaspoon of baking soda. The calcium in the baking soda counteracts your stomach acid to relieve heartburn. To make the water and baking soda taste palatable, add a couple of drops of honey. Step 4. Chamomile, like baking soda, is high in calcium. Like baking soda, it will lower stomach acid while tasting a whole lot better. Step 5. Chew on peppermint leaves. Peppermint is high in menthol, which can help relax the stomach. Did you know? An old wives' tale says that a woman who has heartburn during pregnancy will give birth to a hairy baby.
Feeling the burn?
Quick tips.
Sleep on your left side to help your esophagus's natural curve keep stomach acid from coming up. Sweet dreams.